morning, everyone. My name's Carla Macias, and welcome back for another episode of Best Docs Network featuring Forest Park Medical Center right here in Austin, Texas. In the next 30 minutes, we're going to take a look into some of the amenities at Forest Park, as well as meet some of the physician partners who are changing people's lives. Now let's get today's show started by introducing one of these Forest Park physicians, urologist Dr. Loren Jones. Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
What's been so rewarding for me to be involved with Forest Park is that I've been in the business of helping physicians manage hospitals for 25 years, and I have seen all the various models that have been associated over that period of time. I've been involved in many different kinds of models, and it's been a pleasure for me to implement the model that I think works the best in this business, and that is the majority physician-owned model where the physicians are in control and govern their own hospital and have business partners like me who come in and help them run that business. But we focus on running the hospital the way that the unique aspects of that medical staff wants their hospital to be run.
With the help of the doctors here and at all of our hospitals, we recruit the very best people in all different lines of work, from the OR technicians, the floor nurses, the quality directors. Everyone who walks through this hospital has been very carefully considered. This basically gives our patients the best possible experience. They walk into this place and very quickly are eased of a lot of the stresses of surgery that you get in a cold, sterile hospital environment. The people are very friendly, the place is very welcoming all around them, and of course the quality of care is unsurpassed.
What Forest Park means to a physician is that it provides a place for that physician to practice medicine where he or she is much more in control of their destiny, much more in control of the atmosphere that they practice medicine in. We provide our physicians with dedicated teams of nurses in the operating room who become familiar with the type of surgery that the physician does. That makes the surgery go much quicker. It enables us to get the room turned over quicker between cases so that the physicians can can get more cases done. All of the physicians that I talk to tell me that they are able to get more cases done and in a more efficient manner than any other hospital they practice medicine in.
As a physician, a surgeon actually practicing here, we start your cases on time. Our turnover is very efficient. We have top quality staff to provide you with the people and the equipment necessary to really be state-of-the-art in everything you do.
Did you know eating oysters can keep your immune system strong? A 3-ounce serving has a quarter of your daily iron intake plus twice the zinc you need in a day. Dr. Michael Putney is an orthopedic surgeon who specializes in arthroscopic and reconstructive surgery of the knee, shoulder, and total joint replacement, as well as sports medicine. Now let's hear what Dr. Putney has to say about his methods on practicing medicine.
My methods are always, first the patient comes first. I treat my patients like I or my family would want to be treated, and I always prefer to be conservative and try conservative methods before going straight to surgery. I emphasize to all my staff that every patient that comes in, they need to think of that as their mother or brother or sister coming in to get taken care of by us. I've lived in Texas all my life, so I treat people like a Texan.
Forest Park Medical Center has won many awards over the past few years. Recently, they were awarded for being one of the most beautiful hospitals in the country. One of the many attributes that makes this hospital so aesthetically pleasing is the art. Now up next, we're going to take a look into the art selection process for Forest Park Austin.
Select art, I started about 28 years ago. Magic. Everything all comes together and it's like, wow, this is great, you know, and people are excited and they're lit up and we get compliments, you know, the day we install it from the employees that are around and, you know, it's a win for everybody. So, yeah, we all just keep moving forward.
John has a question for Dr. Gutierrez. Can you feel the spinal cord stimulator?
We can set it to where you can feel it, and we can also set it to where you don't feel it. The sensation when you do feel it tends to be a very soothing buzz. It's described as kind of a light massage over the area that the patient is experiencing pain in, and thus it makes it feel a little bit better. Other patients don't like the buzz. It can be set to where it doesn't create that sensation. Regardless, there's evidence that the neurotransmitters that transmit pain are reduced in the spinal fluid, whether the patient's feeling that buzz or not. What you'll see is a reduction in pain.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside in what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using a robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Forest Park Medical Center is a different kind of hospital, designed for warmth, designed for comfort. Forest Park Medical Center is your destination to better health. By visiting bestdocsnetwork.com, there you could browse through our doctor specialties and video gallery, where you can find the right doctor for you. One of those doctors you can find on our website is Austin family physician Dr. Paul John. Now up next, let's listen as Dr. John explains low testosterone.
Low T, or low testosterone, occurs as men grow older. They become poor producers of testosterone and they start to become symptomatic in their 40s and 50s. We are able now, because of the products that are available, to treat this problem. The symptoms that are most common in people with low T is that they feel tired, they have low libido, they don't feel like doing the things that they normally like to do. And it's an easy diagnosis to make. The part of it that's sort of complex is getting them to believe that the testosterone is going to help them.
When I went to see Dr. John for low testosterone therapy, he said some of the treatment options were the new liquid testosterone that's applied topically under the arms, and that he would remind me to take it about once daily for a year.
We have 3 basic ways to treat testosterone that we do in our office. There's topicals. Second way of treating low T is to use injectable forms. Those are in people who, for whatever reason, couldn't get the testosterone or had bad results, meaning their levels didn't go up on the topicals.
Liquid testosterone application worked just fine for a year. Even my barber said my hair had gotten thicker and I was feeling stronger. The way Dr. John treats me as a patient is absolutely outstanding, because I was a professor in the pre-med studies at a university, And so he and I have some of the same vocabulary. So when we're there, it is like meeting a friend. It is like meeting somebody that you would study with. And we always have a good laugh over vocabulary.
The age group that we focus on in our office is anyone over the age of 40 who is a man. However, we have seen people younger than that who, for whatever reason, have low T.
The vision we had for Forest Park Medical Center in Austin was pretty simple. I mean, we wanted to dig down and really understand what the community wanted. We wanted to talk to the physicians. We wanted to talk to the people that live there. We talked to the mayor and all the city officials, and we really wanted to understand Austin.
Forest Park Austin really represented a unique opportunity for us. Austin's a community that is a little bit more laid back. It's a community that gave us a lot more creative and the ability to be more liberal with the design, do things that were a little bit funkier that maybe wouldn't fit in a more conservative setting like South Lake or Fort Worth.
The art program is something that we're paying a lot of attention to. Some of the finishes are unique to Austin. We're using a lot of the local stones in the facility.
And just a mix of building materials together to come up with a unique project and something that you just don't see every day.
Well, the layout of Forest Park Medical Center is consistent across most of our hospitals. What we'd like to characterize is we have a chassis that works very, very well. And that's not to say that they're the exact same from hospital to hospital, but the fundamentals are the same.
From the time that either a patient or a doctor arrives on site, we want it to be very intuitive. Where do I turn in? Which building is mine? The layout of our lobby, the layout of our doors. If you're a physician, a staff member, or a patient, it's very intentional so that you can get through easily and not have a lot of stresses and anxiety just with reaching your final destination.
We're paying a lot of attention to green space, taking some of the outdoors, indoors, and some of the indoors, outdoors. We wanted to have great transition space, a lot of the local planting, and we have sculpture, so you feel as though it's one area.
Forest Park Austin is going to have a total of 40 patient rooms. They're mixed between private patient rooms and then VIP patient rooms. All of the rooms will be fit out like a very nice hotel. We pay attention to every detail. The quality of the materials used, the quality of the linens that go on the bed, quality of the furniture selected.
We're really paying attention to the patient experience. We have the best surgeons, we have the best nurses, and we have the best administrators. Austin is no different.
Hi, I'm Dr. Torrance Walker with Forest Park Medical Center, and I'm here today to talk to you about medial collateral ligament injuries, or MCL, sprains and strains. The MCL is commonly injured by a blow to the outer aspect of the knee, usually in a contact sport like football, or it can be caused from a twisting injury. However, most patients that have an MCL injury are able to walk on the knee after the injury occurs. However, they may limp. Usually it takes 2 to 3 weeks before the soreness and swelling to go down. There are several different types of MCL injuries, mostly graded 1, 2, and 3. The grade 1 injury is more of a sprain where the ligament is stretched. A grade 2 is a partial tear of the ligament, and grade 3 is a complete tear of the ligament. Grade 1, or it's just a sprain, most of these can be treated non-operatively, of course, with bracing and a little physical therapy. Time off from play may be necessary, usually in the order of 3 to 4 weeks. It's the same treatment for a grade 2 sprain, where it's partially torn. So most medial collateral ligament injuries can heal on their own. Grade 3 injuries, which are complete tears of the ligament, may require surgery if the knee is still somewhat unstable on clinical examination. Surgery in this setting is usually done because there's an associated injury, such as a combined ligament injury with the ACL and the MCL in the same knee. Ligamentous reconstruction of the MCL involves reinforcing the ligament with autograft or allograft. And this can be a source of tenderness or collagen material from your own body or from that of a donor or cadaver. After surgery, the patient is placed in a brace, and it may take, of course, 6 weeks before that ligament fully heals. During this time, the knee is protected with a brace and crutches, but physical therapy is started immediately to begin range of motion exercises to prevent stiffness. In general, if you feel as if you injured your knee or tweaked it and may have an MCL injury, then the initial treatment you should do is rest it, ice it, and elevate it. It's important that you get evaluated by a healthcare professional to assess the stability of your knee and make sure that the appropriate classification is determined for your type of ligamentous injury. Most people don't get a lot of the swelling with MCL injuries as they do with ACL injuries. And that's why I say some people can just go without getting evaluated, or they may feel as if they can go without it and get back into play. What can occur too is if you injured your MCL, that leaves your knee with a little bit of instability, and then you get back out and play and tweak your knee again, and then result in another injury like to the ACL or to the meniscus. So it's good to get checked out by an athletic trainer as soon as something happens, just to be certain that you have just a grade 1 or grade 2 sprain and not a more serious type knee injury.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
The physicians over at Forest Park Medical Center make it a priority to get involved in their communities, whether it's here locally or around the world. Up next, Austin plastic surgeon Dr. Craig Hobar and his LEAP Foundation have traveled to many parts of the world to change people's lives.
The LEAP Foundation, we've been here since 1991, and we have operated more than 8,000 kids in more than 19 countries. Cleft lip and palate is our main operation, but we identify needs and we provide pediatric urology, we provide eye surgery, we provide ENT surgery, we take care of burn scar deformities. We really try and fill in the blanks of what is most needed in the particular country. We go on 6 to 8 trips a year. We routinely go to India, central India, the poorest, most remote part of India. We go to Zimbabwe and work in the children's hospital of that country. We go to Haiti multiple times a year because we started going there after the earthquake and developed deep relationships and just saw how many kids were in orphanages and had no access to surgical care. We go to Belize. We've been going to Belize for 18 years. We've been going to the Dominican Republic for 22 years. The most common procedure we do is cleft lip and palate because 1 of every 700 babies is born with this. The children don't have a chance for normal life if it's not fixed. If you do the surgery, then they have a chance for a perfectly normal life. I didn't start out in 1991 to build the LEAP Foundation. I went on a single mission trip, and it convicted me personally that there was such a need out there that I wanted to help as many people as I could. But the excitement from the other doctors and nurses who developed the same passion is what convinced me that no, this wasn't a single mission trip. We're going to go on another one, and then God filled in the blanks. We're here 22 years later. We've done more than 8,000 surgeries, and the opportunities to help people just keep growing. And we all do it because we're helping other people, but it also helps us too. It refreshes why we went into medicine in the first place. But we do it with a world-class quality. We don't do anything in another country that we can't do with world-class quality equal to what we can do here.
Michael has a question for Dr. Terry Chambless. When do I need to get my first colonoscopy?
Everyone needs a baseline colonoscopy, which is about 120 centimeters long scope, and the patient is sedated for it and they don't feel it when they're age 50. And then depending on what's found, it can be a repeat colonoscopy anytime from 1 year later to 7 years later. Now, if there's a family history of colon cancer or colon polyps, we move that up 10 years to age 40.
Charlotte was born through a C-section, and when I first saw her, I thought maybe her ear was folded over just because that was how she was in the womb, but it became pretty clear after the next couple of days that it wasn't going away. It was just floppy, the cartilage wasn't formed properly, and so we decided to try and fix it.
As a practice that specializes in pediatric reconstruction, one of the most common deformities that we see are deformities of the ears. The standard of care for these historically has been surgery. You know, you wait until the child's in kindergarten or first grade when it becomes a social issue, and then there's a type of surgery called otoplasty that we perform. In 2010, the FDA released an ear molding device, which has radically changed the way that we manage ear deformities.
I just know kids can be really mean, and I certainly didn't want her to not be very self-conscious about it until she started going to school and then have people make fun of her and have kids say mean things about her. We chose the earwells over plastic surgery because we thought it would be a safer option for all of us, and we just didn't feel very good about her getting surgery when she was even 4 or 5. I remember Dr. Cohn being so friendly and being so kind and explaining to us exactly what was going to happen, exactly what was going to go on. And he said Charlotte was a perfect candidate for it.
It has an external cradle which sticks directly onto and around the ear, and then we have customizable pieces that help hold the ear to a normal shape and position. So you keep the earwell device on for 4 to 6 weeks so that the ear has had enough time to learn a normal shape.
I was really, really happy with the results and the fact that it was virtually painless. I am extremely grateful that we did it when we did because the cartilage wouldn't have formed if we would have waited. Time was of the essence and we needed to do it as early as possible. So I'm very grateful that we were given the information for Dr. Cohn so that we could jump on it real fast.
Lodging provided by Radisson Hotel and Suites. And that'll wrap up this week's episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. Now, if you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. I'm Carla Macias, and we'll see you next week.